Hi, Sonia. Welcome. My name is Martha. Have a seat. Thank you. Thank you so much for coming in. How are you doing today?
I'm okay. I've been better.
Okay. Well, tell me a little bit about why you're here.
Well, I've been having a lot of problems with my current medication, and it's really hard for me to focus, and I do need the medication, but at the same time, the medication just does weird things to me, so I want to see what other options there are.
Okay, so you're taking medication for something and you just don't like the side effects it has on you?
Mm-hmm.
What is your medication for?
It is for my ADHD.
Oh, you have ADHD. Okay. So ADHD typically, it's a problem where brain activity is exaggerated, and so people have difficulty concentrating. Tell me a little bit about what's most difficult for you with this diagnosis with ADHD.
Well, right now I have to do a lot with work. I work in an office, and I have things that I have to do, but for some reason it's just been really hard lately. And so when I do take the medication, it gives me it just doesn't feel right sometimes. So, and then it makes it even harder to focus on work. So a lot of the times I'm actually having to call in, and I just can't do it.
I understand that it's your livelihood. You need to work to support yourself, and so certainly looking at different treatment options is a good option at this time. So let me tell you a little bit about what we do here. Did the doctor that referred you to us explain to you what this referral was about?
He did, but it didn't really make sense. If you could maybe tell me a little bit more about it.
Yeah, definitely. So it's sort of like scientific-y, that's how I say it, explain it to people, okay. Terminology, so some of it, may even seem foreign, but I'm going to try to break it down to you as simple as I can.
Okay.
So this treatment is called neurofeedback. It's also referred to as biofeedback. Biofeedback therapies, neurofeedback therapies, are technology, basically, that was designed decades ago. It dates back to the 1960s, 1970s, but more recently in the 80s and on, has it been used to treat ADHD. So the technology itself is, right now, it's different things. It could either be a head, like a hat.
Okay.
I don't know if you've ever seen like science shows where people like have this little plastic scabs that have like almost like strings coming out of it.
Yes.
We're beyond that technology now, and now you can actually wear an arm piece that this technology can read your brain activity. So it's connected, this arm piece is going to be connected to a program in a computer where in conjunction with how this technology in your arm is reading what's going on with your wave activities, your brain, if it's relaxed, if it's excited, if it's kind of unmotivated, it'll feed it into that computer program. And the computer program, what it is, the treatment itself, it's you sitting in front of a computer and playing almost like kids games, computer games,
okay.
But they're all designed to improve concentration, to target areas where you become distracted.
Mm-hmm.
And so through a number of sessions, the program itself will begin to identify what Sonia's, primary concerns are, whether it's becoming distracted in a very short time period while you're doing something, or whether it is a lot of activity going on that you have like a lot of thoughts. Did any of that make a little bit of sense to you?
I think so. Is there a lot of people that have been doing this type of therapy?
I'm going to say this, that it's in regions. So here in Yuma, Arizona, it's brand new. So I would not be able to, let's say, I have this group of people that have already done it and it's successful. But in places like Boston, Philadelphia, San Francisco, so like the bigger cities where there is a lot more, let's say maybe resources or educational programs like universities that actually do this research, there you would have where we find that most of the research has been done. There is a lot of studies, and you don't have to agree to it right away. If you want to learn a little bit more about it, we can do that as well. I can give you some information for you to take home that kind of shows you how long this therapist has been doing and how successful. There are very little side effects, so people don't have complaints about it giving them problems. It's just a matter of kind of going along with the program and seeing if it works for you. Because it is client fit, meaning if it's going to work for you, we'll know in several sessions. But, sometimes for some individuals, it takes longer than just, a couple. So do you have questions about what we just said right now? And please feel free to ask. I know that this is maybe not easy to understand right away.
I think at this point I'm pretty much willing to try anything to try to change how I feel at this point, because it's been just too hard. So, I guess is there any way is there like anything you could show me or anything that I can do in order to kind of know what I'm going to be doing?
Yes, definitely. So, do you play computer games yourself? You don't have to, but I'm just wondering if you do.
Yes, I do sometimes.
Sometimes. So the computer, it's this one right over here. So if you just want to sit right there, what we do is this right here is the actual technology. The part right here, you see these little sensors? These have to be touching your skin. So we're going to place this and wrap it around in an area that is comfortable to you. I have, bands that can adjust to your arm. Some people don't like it in the arm because they feel like it's going to, they're comfortable doing arm movements. So if they're conscious that something is on here, they kind of get tensed up. So on some people will put it down in the leg. So it just depends where you're going to be comfortable. Do you want to try and see how it feels on your arm?
Sure.
Okay. Do you think it's something that would bother you to have it in the arm?
I don't think so.
Yeah? Okay. So we can probably, do you usually rest your hands like this? Like how are you relaxed?
Probably like this, yeah.
Okay. So then we'll do it like this.
Okay.
So we're going to just, I'm going to kind of snug it for you, and then you tell me if it feels too tight or when it feels okay.
That feels good.
That feels all right? Yeah. Okay, it's in place. Okay. So then we turn it on right there. When the light comes on, is the light on now?
Yes.
Okay, so now we're connected to the actual program. So do you see the screen that's up there? Okay. So then the way this works, and we're not going to start a game today because we actually had to do the actual assessment tool that tells us where you are in terms of being, distracted or impulsive or however the areas where you have the most difficulty. But you can kind of see right now the different types of games. I'm going to kind of move my mouse over here. So this game right here, it's you are going to actually just concentrate on looking on one of the characters. You can pick from a submarine or from a dolphin. A lot of these games are kid-focused, but they work just as well with adults. So all you're going to do in this particular game is actually just watch the whale swim. It seems like, well, I'm not really doing very much, but you are, because what the game does to start off is you have to be focused in just that one task, which is watching the whale swim. So before we actually start, we're going to do a couple of breathing exercises to kind of just help you get relaxed. We're going to go over what the game rules are, and then we're going to go. The game itself takes less than 5 minutes. And so what you would do is watch the whale swim, and the whale, will go down. You're going to see it actually go down all the way to the bottom of the ocean floor, where it's going to collect treasures. the more relaxed you are and the more you're actually just watching it without any thoughts filtering in, the lower the whale swims.
Oh, okay.
But if you're trying to tell the whale to swim, or if you have other thoughts coming through, or if you become distracted and like kind of looking away from the screen, or just, typical things that happen when we lose concentration and focus, the whale will start swimming up.
Oh, wow.
So, and it's all because of the technology here that is reading what's going on up here.
Okay.
Does that make sense?
Yeah, it does make sense actually.
Yeah, I can take this off of you now. So there's several games, and as you play them, the program itself will start to challenge you individually, because it'll start to recognize when you're starting to lose control.
Okay.
Now, I've talked a lot already. Have I lost you in any way?
No, I think I'm more excited to start something new because, like I said, I just need help right now. So I'm willing to try it, and I'm really thankful that there's some other option that hopefully will work. So I'm ready for the next step.
I'm glad you're hopeful, and I think, remaining optimistic with new treatments is very, very important. So I commend you for, trying something different. I do gotta let you know, though, that typically best results are done within anywhere from 20 up to 40 sessions. So that could be anywhere from 6 months where you actually know that the program is working. Is that going to be a problem for you?
I don't think so, but I can let you know if it is, but I don't think so at all.
And it's completely up to you and your provider whether you choose to stop taking the medication or not. Studies have shown effective results with either or. But if you decide to continue taking medication, then it's recommended that you continue taking it throughout the length of the course of the treatment plan. Or if you decide not to take the medication because, like you said, you don't like the side effects, then you want to just stay off of it so that there is no interruptions of how your actually medication is affecting your brain activity. Okay? All right, well, we can go ahead and schedule our sessions. We can do sessions twice a week. That's what's, the minimum amount, or we can do 3 times a week. If you come twice a week, it's 30 minutes. If you come 3 times a week, it's 20 minutes. So we would just schedule all of that in a minute. Okay?
Okay, thank you.
Thank you so much for coming, Sonia. Any other questions?
No, that's it.
Okay, thank you so much. Okay, bye-bye.
Bye.